You wake up every morning and your lower back feels like it is locked in a block of cement. You struggle to stand up straight. When you try to lean backward or reach up to grab something from a high shelf, a sharp, grinding electrical pain stabs deep into your spine. As the day goes on, your legs begin to feel incredibly heavy and numb, making it difficult to walk for more than a few blocks. You finally get a magnetic resonance imaging scan. The doctor looks at the report and tells you, "Good news, you do not have a herniated disc." But then they read a phrase that sounds terrifying: severe facet joint hypertrophy, or spondyloarthrosis. They tell you that you just have arthritis, prescribe you anti-inflammatory pills, and send you home. But the pills do not work. The grinding pain remains, and the heaviness in your legs is getting worse. If you are trapped in this cycle, you must listen very closely. You are not just experiencing normal aging, and your pain is not in your head. You are suffering from a severe structural failure. Your spine is actively growing extra bone, and that bone is acting like a physical clamp on your nervous system. Today, we will explain exactly why your body is doing this and how we can permanently release the pressure. To understand why your spinal bones are overgrowing, we must look at the mechanical engineering of your back. Your spine relies on a dual support system to handle gravity and movement. In the front of the spine, you have the rubbery intervertebral discs. These act as the shock-absorbing pads. In the back of the spine, you have pairs of small bony connections called facet joints. These act as the mechanical hinges. They allow you to bend, twist, and lean backward smoothly. In a healthy spine, these facet hinges are coated in a thick, slippery layer of cartilage, allowing them to glide with zero friction. But this perfect system is vulnerable to a chain reaction. As we age, the rubbery discs in the front of the spine dry out and collapse. When the front pad loses its height, the mechanical load of your entire upper body shifts backward, crashing directly down onto those tiny facet hinges. The facet joints were never designed to carry this massive amount of weight. The smooth cartilage is rapidly crushed and scraped away. The joints begin to grind bone on bone. This triggers massive inflammation. The human body is an incredible survival machine. When it senses that a joint is wobbling, grinding, and failing, it attempts to stabilize the area. The body sends calcium to the joint to build extra scaffolding. The bone begins to expand and grow thicker in a desperate attempt to lock the wobbly hinge in place. In medicine, we call this abnormal bone growth hypertrophy. This biomechanical reality exposes a catastrophic flaw in how general back pain is treated in local clinics. When a patient complains of a stiff, aching back, general doctors and physical therapists often recommend aggressive stretching. They tell the patient to do yoga, specifically stretches like the cobra pose, where you lie on your stomach and push your chest up, bending your spine severely backward. If you have facet joint hypertrophy, bending backward is the absolute worst thing you can do to your body. When you arch your back, you are physically driving those inflamed, overgrown, arthritic hinges directly into each other. You are violently grinding the bone-on-bone surfaces together. This will instantly trigger massive, debilitating muscle spasms as your body tries to protect the joint from your stretches. Furthermore, Swallowing muscle relaxers or generic painkillers will do absolutely nothing to shrink an overgrown piece of bone. You cannot cure a mechanical bone obstruction by stretching it or sedating your brain with chemicals. We cannot guess the severity of this condition by pressing on your back. We must act as elite medical detectives and look directly inside the joint. When an elite neurosurgeon evaluates an MRI for spondyloarthrosis, we focus on the axial or top-down view of the spine. We bypass the disc in the front and look directly at the hinges in the back. In a healthy spine, the facet joints look like a clean, delicate V shape with plenty of room around them. In a spine with severe hypertrophy, those joints look like massive, dark, swollen boulders. But we are not just looking at the size of the bone, we are looking at the collateral damage. Immediately next to the facet joint is a thick ligament called the ligamentum flavum. When the joint becomes arthritic and unstable, this ligament also thickens and buckles inward to help stabilize the spine. We must measure the exact millimeter of the spinal canal. We calculate how much the overgrown bone and the thickened ligament are pushing inward, and we determine exactly how much space is left for the spinal fluid and the nerves. This brings us to the most dangerous phase of the disease, the bony clamp. The facet joints sit immediately next to the neuroforamen. This is the tiny bony tunnel where the individual spinal nerve root exits the spinal cord and travels down to your leg. When the facet joint hypertrophies and grows massive bone spurs, that extra bone has to go somewhere. It expands directly into the nerve tunnel. It acts like a vice grip, slowly closing around the nerve cable. This condition is called foraminal stenosis. This is exactly why your legs feel heavy, numb, and weak when you walk. The overgrown arthritic bone is physically choking the blood supply to your sciatic or femoral nerve. If we see on the MRI that the protective fat layer around your nerve has been completely squeezed out and obliterated by the overgrown joint, we know your nerve is in critical danger of permanent damage. Because facet hypertrophy is a disease of physical bone growth, our treatment protocol is strictly mechanical. If the MRI proves that the overgrown joints are inflamed and causing severe back pain, but they are not yet crushing the spinal nerves, we use precision pain management. Under live X-ray guidance, we can perform radiofrequency ablation. We use controlled thermal energy to safely burn and deactivate the tiny sensory nerve that connects the arthritic joint to your brain. The joint remains overgrown, but the pain signal is permanently disconnected. However, if the MRI proves that the overgrown bone is actively choking your main spinal nerves and causing your legs to go numb, we must physically open the tunnel. We do not use massive open surgery that destroys your back muscles. We use advanced endoscopic decompression. Through an incision smaller than a coin, we insert a high-definition camera directly into the spine. Using specialized microscopic instruments, we gently shave away the overgrown arthritic bone spurs from the inside out. We literally grind away the clamp, physically freeing the trapped electrical cable. The moment the bone is removed, the nerve expands, the blood flow returns, and the heavy burning sensation in your legs disappears. Many patients accept the heavy, aching pain of spinal arthritis because they believe it is just a normal part of getting older. They spend years taking dangerous daily NSAIDs that destroy their stomach lining, and they slowly stop walking, traveling, and living their lives. But let us look at the true cost of ignoring this condition. If you leave a crushed spinal nerve clamped inside an overgrown bone tunnel, the nerve will eventually die from oxygen starvation. You will permanently lose the strength in your legs, leading to permanent mobility loss. You are risking your lifelong independence because your local doctor told you to just take painkillers. For a fraction of the cost of years of useless therapies, you can have an elite neurosurgeon review your imaging, potentially identifying the exact location of the bony clamp and saving your nervous system before the damage is permanent.
If this video helped you understand your pain, please click subscribe. It allows us to keep providing free, elite medical education to patients worldwide who cannot afford a neurosurgeon. You are watching this video because you are looking for a real solution to your pain. But you cannot fix a mechanical spinal problem by guessing. And you cannot dissolve overgrown bone by asking questions in a comments section. Every spine is unique. Click the link in the description to upload your MRI or CT scans to our secure portal. Our neurosurgeons will personally review your imaging, measure the exact size of your facet joints, and build your personalized, minimally invasive treatment plan. Stop living in pain, stop accepting a mystery diagnosis, and stop guessing. Let us find your solution today.